Hello and welcome everybody. Welcome to today's webinar. My name is Marie Macaulay from the UNESCO Institute for Lifelong Learning in Hamburg. Thank you very much for being here. Welcome to the webinar, the ninth webinar from the UNESCO Global Learning City Network on mental health, health and well-being in the context of the coronavirus COVID-19 crisis. This webinar is taking place as part of our thematic webinar series, and we will be hosting a few additional webinars in the coming weeks on different topics. Stay tuned through our UIL newsletter. Today's webinar will last 1 hour. The webinar is being recorded and the recording will be made available on the UIL YouTube channel. A link to that particular page will be shared in the chat. You'll be able to access it directly there. The webinar will be similar to that of last week's for those that were here with us. We'll have individual presentations followed by a question and answer session. We'll try to ask one question, maybe a clarifying question, to the different presenters during or right after their presentations, just to maybe help clarify a few points if needed and if we have the time. Otherwise, we'll try to really get answering the different audience's questions during the Q&A session. If you're interested in hearing from us after this webinar, and if you also would like to hear generally about these different topics that we're covering, please sign up to the UIL newsletter by clicking on the link that will be provided directly in the chat, and feel free to review our weekly summary reports of the webinars that are posted to the UIL website as well. Now, just a logistic note, the audience is completely muted. So we really ask that if you have questions during the presentations, you use the Q&A option that appears at the bottom of your bar here for the Zoom on the Zoom platform. This is where we'll be drawing from to ask the different questions at the end during the Q&A session. If possible, refrain from using the chat bar for questions because it's quite tricky to filter through the different interventions in there, whereas the Q&A really provides us with an overview of all the questions and we can then ask them. I hope that's clear. And last little thing, when you do write in the chat, if you wish to speak to each other or speak to us through the chat, make sure you speak to everyone, not just the panelists or not just to one person, so that we can then, different people may be able to jump in or answer a certain point. Now, little announcement before we get moving to our welcoming remarks. The period for the membership applications for the UNESCO Global Network of Learning Cities will be extended for another 2 months given the current context. Cities now have the possibility to apply until June 30th, 2020, and national commissions have 1 month until July 31st, 2020 to endorse the whole procedure. All relevant information, including the membership applications form, are available in the following link provided again in the chat. So quite a few links. These will be shared throughout as needed and also again at the end. And now before I introduce our speakers for today, I'd like to open the floor to my colleague Christina Drews from the UNESCO Global Network of Learning Cities, who will introduce the session for us. Christina, over to you.
Yes, thank you, Marie. Thank you so much. And I would like to thank everyone here today for their participation in this 9th edition of our webinars as response to the COVID-19 pandemic. This is a response to all of our members of the UNESCO GNLC network, but also beyond. Even before Corona, the United Nations had the goal to ensure healthy lives and promote well-being for all at all stages. This is Sustainable Development Goal 3, and the sentence that there can be no sustainable development and no economic progress without health was as true then as it is today. As a result of the global pandemic, this sentence has reached a new dimension never thought possible. We are now in the midst of an unprecedented health crisis, a crisis triggered by the virus COVID-19. The implications reach far beyond the scope of virology. People are being asked to isolate themselves, businesses are closing down, certain people are being quarantined, and we are all supposed to keep a safe distance from another. Physical distancing is necessary to avoid the spread of the virus, but at the same time it increases the rate of mental and emotional stress. The uncertain incubation period of the virus causes additional fear and anxiety. The sudden loss of daily structure hits different age groups, ranging from children to elderly people. Coping with all the changes and the anxiety increases the vulnerability of mentally ill people. How are different groups of people handling their new roles, and what are their expectations of work, for schools, and for the community? Nearly 55% of the world's population is living in urban areas today, meaning that approximately half of the world's population is faced with massive restrictions. In extreme cases, social distancing can be equal to social isolation. And we want to really inquire, how are these preventive health measures affecting psychologically? In many other situations, people face challenging demands by managing work and family demands simultaneously. And I'm not even talking today about those for whom the virus represents a real death threat. To address and counter this social anxiety, emotional and fearful insecurity, it is urgent and necessary that families, teachers, and communities build vital coping skills and emotional resilience. A good quality education is the foundation of health and well-being. For people to lead healthy and productive lives, they need knowledge to prevent sickness and disease. For children and adolescents to learn, they need to be well-nourished and healthy. Resilience is the key word. It is essential. Lack of planning and preparation for the outbreak has highly demonstrated the importance of resilience. The ability for human systems to anticipate, to cope, and to adapt. Communities and the citizens that comprise them should be seen as active agents with knowledge and energy and power to shape their responses now and in the future. And in order to achieve this, lifelong learning opportunities are absolutely essential. And this is one of the visions of our Learning Cities network. Their commitment is to become resilient and sustainable as a human settlement. Today, we will explore the multidimensional topic of mental health, health and well-being, and we'll hear about effective measures to protect and enhance confidence of all citizens in the pandemic time. We want to share again good practices nationally and locally to ensure effective interventions. We hope again to hear concrete city-level strategies that can be shared with our network and around the world. For this 9th webinar, I'd like to briefly introduce my colleagues around this virtual table. As usual, we have interesting guests from all corners of the world. We are very excited to start with our opening speaker from the World Health Organization, Ms. Monika Kosinska. She's the WHO Europe lead on governance for Health and Healthy Cities Network. She will be followed by Ms. Julia Pridmore, Director of Health and Wellbeing Academy from our GNLC member city Swansea in the UK. Our second learning city today comes from Colombia, and we have invited Mr. Camilo Yunes, representing the University of Manizales in Colombia. And last but not least, we will hear from Ms. Marilyn Turkovic about cities and communities belonging to the Charter of Compassion Network. The network works to establish and sustain cultures of compassion locally and globally through diverse sectors. So there is again a great variety. And let me say good afternoon to Ms. Kosinska and Ms. Pridmore, and good morning to Mr. Yunes and Ms. Turkovic. My colleague Mary will be your moderator for the next 50 minutes. Thank you very much. Mary, back to you.
Thank you, Christina. Thank you so much for that overview and introduction. So we'll now move on, and I'll invite our first speaker for today, opening speaker, Ms. Monika Kosinska from the WHO. I will be uploading your slides in just a minute, and you're welcome to now just go ahead with your presentation. We can't hear you, Monika.
And good afternoon to those of you who are already past your lunch hour. First of all, thank you very much to UNESCO and to colleagues for inviting me to open the very interesting and very important session that you have ahead of you today. And thank you, Christina, for the excellent introduction, which I think gives us the perfect framing in terms of how and what we are needing to look at. Slide. I'm going to, there we go, thank you. So what I'm sharing with you now is the daily, what we call the SITREP, which is the overview that we publish on our WHO website, giving us the countries, areas or territories with COVID reported cases over the last 7 days. And I don't think I need to tell anyone here on the call that the bulk of our cases are in the European and the American regions, and we can see the distribution here. And if I
Monica, you're cutting a little bit in and out.
I can see that I am being muted and unmuted. That's not me, I'm hands-free, so I'm not sure if that's happening.
That's very strange.
Yeah.
So maybe if I may suggest that you just take out your microphone just for your presentation, or your headphones and microphone in case that's tampering with the...
Let me try from here to see if that is better.
Okay, thank you. Let's keep going.
Thank you, Marie. So the complexity and the uncertainty that was alluded to and initiated by Christina is presenting us at a critical moment where both countries and cities are facing very difficult choices. In the European region, we see this as 4 parallel sets of demands. First of all, the outbreak of the virus itself. We do not yet have proven vaccines or therapeutics, which means that this is a situation which is continuing to evolve and frame the work and the lives of all of us who are experiencing it. Second of all, the burden and the demands that are placed on our health services, including those on staff, and not only in responding to COVID, but also to maintaining essential care and services. Third, as mentioned already by Christina, the burden that physical distancing is placing on individuals, on families and communities, and of course, therefore, local government services, as we are all learning to adapt and meet the demands that are put on us under different circumstances. And finally, what we are seeing is the emerging economic crisis and the challenges that this places on employers and businesses and economies and the knock-on effects that is happening. And of course, the role that cities have to play both in the response efforts and the recovery efforts are crucial. So next slide, please. And do tell me, Marie, if I can control the slides myself. Thank you. So the cities in itself is our natural epicenters in the pandemic. We're seeing this. They are often the entry points into countries. They are the transmission points across countries, and they are important places for community transmission, the points where when we are seeing a demand for healthcare surge, where international and national travel and trade hubs meet, and of course the wider entry points into countrywide transmission. At the same time, we know that cities are the closest level of government to people, municipal governments working with all within our territories, including the most vulnerable and the undocumented. And therefore, using local government as an entry point to reach people, particularly with risk communication messaging, is very important at this time. The cities are going back one, thank you. The operational partners of national governments. We have national response plans. We have that are meeting international commitments under the international health regulations and others. And of course, seeing and engaging cities and using the strengths and the assets within cities, including the populations themselves, is critical as part of not only the response efforts, but building back better, building a future that is better for all of us. And then the role of networks is key, and this is something that for us I've mentioned in previous opportunities to speak here, the role that the Healthy Cities Network and the importance that we place on that in the WHO European region and beyond, but also sharing our learnings between the different networks. We know that networks are bigger than the sum of the parts, and the importance, particularly now, of solidarity, of mutual learning and sharing of experiences as things evolve and move quickly is critical. Can you hear me? I'm being muted by the host.
Yeah, it's a bit strange. I can hear you now.
Okay. I keep having you are muted and unmuted by the host on my screen. So
not me. Thank you. Sorry.
The two elements, and I'll touch on both of them, where the cities play a critical role, are of course the response efforts themselves, and then the focus of the discussions today in terms of building resilience and sustainability, although well-being and lifelong learning is critical as a community action and community measure and response efforts also. So if I take the second in terms of resilience and sustainability, community resilience, societal cohesion, and the community actions that support it, including the provision of art, opportunities for learning and culture, are part of maintaining the fabric and the social bonds which allow us to respond and to maintain the elements of our population measures and resilience that can be supportive in both the immediate needs, but those of us that need support more, as well as contributing to the future. Next slide, please. So in terms of mental health and psychosocial considerations, we know that that the pandemic is having a significant impact, not only on public health in terms of individuals, but also at the community level. The elevated stress and anxiety, the increasing levels of loneliness, potential for depression, harmful alcohol and drug use, as well as self-harm or suicidal behaviours. We know that frontline workers and those may be experiencing additional stresses, particularly they are unable to access the social support that they may have had before, the reduced capacity for basic self-care, risks of stigmatization and transmission to patients, friends and family. And of course, we've mentioned them already, but the vulnerable groups, particularly children, people with disabilities, older adults, pregnant women, people exposed to gender-based violence or immune-compromised and ethnic or cultural groups at risk of stigma and discriminations are of particular concern. And the support that city and municipal governments are able to provide and the wider community support that they're able to mobilise and engage is critical in order to allow us to support and respond. Next slide, please. So the four key components that we have in our European response efforts not only to manage the transmission, but to modulate the restrictive measures. First of all, the public health and epidemiological considerations, and that these must drive the decision-making process. The available capacity for the health systems management, as well as leveraging the social and behavioural perspectives to allow for responsive engagement of population. But as a wider point, the social and economic support, which includes the community and the access to wider services in order to mitigate the devastating effects that COVID can have on our individuals, families and communities, not only in the short term, but medium and long term. So cities have roles across the whole of the four dimensions here, not only in delivering services, reconnecting societies and building a sustainable and resilient future. Next slide, please. So I'm coming to the end of my slides, and here we have a number of resources that actually I'm presenting for the first time, as some of them have only been published in the last 24 hours. But for cities and local governments, we have now a resource page and that was published towards the end of last week, I believe, with a number of resources across different areas, including transmission, surge issues, communication issues, and others. There is a simulation exercise that's been published for urban environments, the needs assessment for the first needs assessment from the Healthy Cities Network. There is a partnership for Healthy Cities Global Leadership Series. There's a webinar this afternoon, tomorrow afternoon, and interim guidance that's been prepared and was published yesterday on strengthening preparedness for COVID in cities and urban settings, which includes some of these wider dimensions. And my final slide, please. And finally, on mental health specifically, so we have the WHO briefing note on mental health and psychosocial considerations, as well as the Interagency Standing Committee, which provides the guidance that is underpinning the work that we are supporting member states and cities with here. There's additional briefings in relation to social stigma that's available, as well as infographics and communication material that's available for all cities and interested parties to use as they communicate with their communities and citizens. So just so my concluding comments in terms of the critical components that this has in our immediate and our future work, because we know the importance that lifelong learning plays in terms of asset development. We know how this is going to be one of the cornerstones to allow us to be able to not only meet the needs that we have now, but also to respond and build back better. And therefore, I'm very much looking forward to the presentations from colleagues today and the discussion. And thank you once again for the opportunity to be here with you.
Thank you, Monica. Thank you, and apologies for the muting. I'm not exactly sure what's happening here with that, so I'll try to keep an eye on it. There's a few questions that popped up. I think I'll ask 1.5. One question I think you could respond to, hopefully briefly, is just by saying whether or not the different strategies you've mentioned have been more or less achieved or implemented in cities worldwide, and are there kind of typical examples or really good examples you could share from certain cities. And one question that perhaps we could address throughout the presentation that we can keep in mind is, what role does lifelong learning play in these particular cities and in this particular strategy that you've just mentioned and the different initiatives being led by the WHO? So if you could maybe answer those questions very briefly now, and we can also get back to that second question, I think, a little bit later on.
Thank you very much. So in terms of good examples, there on the EpiWin page, which is the first link that we had on the resource page, we're in the process of collecting examples to be able to share there. And this, for obvious reasons, for the WHO purposes, we need to undergo a validation process in terms of the good examples that we're sharing. So at the moment, this is still a resource that's being developed. From the Healthy City side, we have a number of publications. Where I put one on there that gives examples of the work that different cities are doing. The webinars that we hold for the Healthy Cities Network, which is about 1,500 cities in the European region in total. This is every 2 weeks, but they're closed webinars, so for the network members. So the reports are only published afterwards. But what I can do is I can send through perhaps afterwards a list of where we have city examples in different areas, and provide a way for colleagues to be able to share that as they are moving forward. One thing that I would say with regards to lifelong learning, and I think that what is very important, is that we are considering transitioning to a new normal. So this obviously, as we've seen different countries and different cities be affected at different points, and everyone is experiencing this from their own particular perspective. And as we move towards living with the virus and what this means for us in the medium and longer term periods, the role of lifelong learning and the role of education services in general, and access to or continuing to provide support and access to education as part of a well-being approach, and I don't mean school-based education, I mean wider adult learning and so on, is going to become more and more important and at the forefront of allowing us to transition to living with the virus and the new normal.
Thank you for that. It would be great, in fact, to get those links of the different cities with the current strategies being implemented, and we'll be able to share that with the network, as well as in our summary report. Just a reminder to everybody on the webinar right now that all the slides are going to be uploaded to our website, where we post the summary report for each webinar. So moving on now, I'd like to invite Ms. Julia Prinmore, our second speaker, from the Director of Health and Wellbeing Academy from the city of Swansea, one of our member city of the Global Network of Learning Cities. Ms. Julia Prinmore, the floor is yours, and I'll be uploading your slides in just a second. And I cannot hear you.
Can you hear me?
Yes, thank you.
Thank you very much. Well, good afternoon, or good morning or good evening, depending on where you're accessing this from. And to those people in Welsh, prynawn da. I'd just like to introduce myself really and my background. As the director of the Health and Wellbeing Academy, I'm also a registered nurse and support nursing and other healthcare professionals who are out on the front line managing the COVID-19 pandemic at the moment. So I feel I have some credentials in talking about health and well-being in the current situation. If you could move on to the next slide, please. Thank you. The Health and Wellbeing Academy is unique in Wales in that it's trying to work in partnership with not only our healthcare providers in the National Health Service here, but with social care, with other academics, and to support regional wellbeing and the aims of the Swansea City as a learning city to improve and develop skills, wealth, entrepreneurship and education for the whole population, including key areas of development that are planned as part of big investments in 2 different city deals. If you could move on to the next slide, please. Just bringing us right forward to some of the issues that are very prevalent at the moment in the UK. I think what the current pandemic is doing is really exposing underlying inequalities and prejudices that have existed for some time, particularly in the UK. And particularly my area of interest is being both as an NHS practitioner and as an academic in how elderly people in particular are affected. And I think some of the narrative around how older people have been treated during this pandemic, particularly in the UK, prior to the pandemic hitting, we've had a narrative around older people as being burdensome to our NHS, of being bed blocking, undeserving of particularly intensive care type therapies and other expensive treatments. That was crystallised in a headline in the Guardian newspaper when a Welsh surgery wrote out to older members of its population, asking them to sign "please do not resuscitate" orders and asking them to refrain from using resources such as ambulances if they were in need of help. If you could just click onto the next box and the next one, please. So that prompted the Welsh Advisory Group for Moral and Ethical Guidance to produce guidance for Wales. And I think it's significant that they felt it was important to have to say that those with an equal chance of benefiting from healthcare and resources should have an equal chance of receiving them. And I think, again, you know, when we think about the crisis that's currently evolving in the care home sector, these older people are an extremely vulnerable group. They have not had access to testing, protective equipment that maybe is more easily available in other settings. Next slide, thank you. So I just wanted to point to what's happening in the UK to try and actually address some of the big questions that the pandemic is raising. So as a group of 24 world leading experts have been convened by the UK Academy of Medical Sciences and a mental health research charity to call on global researchers really to pool resources to try and address the questions that are facing us at the moment. So they want to look at how we can limit the impact on mental health of the current situation, the lockdown rules and regulations and the effects of isolation and social distancing, to try and understand how best individuals can cope and look at the individualized approaches to this rather than just blanket rules and regulations. They're trying to track loneliness so that we can intervene early to mitigate the effects of that. And again, older populations particularly have been reporting high incidence of loneliness long before the pandemic struck. And then also trying to understand the impact of constantly consuming news related to the current pandemic. It's very tempting when we're at home and TV and radio, maybe for some older people who are digitally disadvantaged is our only source of information, to be bombarded with constant messages of death and suffering and trauma related to the pandemic. What the group have done is identify actually the most vulnerable groups that they're interested in researching. If you click the next section for me, please. So these are children and young people, older adults with multiple morbidities, those already with existing health issues related to their mental health, that feel at risk of either exacerbating their condition or restarting something that they've been managing up until now, those on the front line, those with learning difficulties or neurological disorder or neurodevelopment disorder, and those groups that are socially excluded, including, for example, those in prisons or the homeless. And in the UK, we are seeing a rise in homelessness for populations that previously wouldn't have been homeless prior to the pandemic. So those who've worked in, for example, the hospitality industry, particularly those that may have travelled from overseas to the UK for those jobs and now find their wages have run out, they've got no job and they're homeless. Next bit. And those on low incomes, of course. And I think Monica mentioned, of course, the financial and impact of the pandemic globally. Other work that's being done is by a UK household longitudinal survey. This survey runs throughout the year anyway, but it's particularly important now. And they're looking at understanding the changing impact of the pandemic on the welfare of UK individuals. And the surveys, including 42,000 adult participants, and the first data from this survey is going to be released today. And they will be looking at doing further, producing those results further in the year and extending the survey, because at the moment it's a digital survey online. So they're looking to extend participation by running telephone interviews with those people who are not connected. And again, that typically does tend to be older people, people on lower incomes and so on. So some of the questions they're interested in are looking at symptom tracking, looking at caring responsibilities, loneliness, the effects of homeschooling, alcohol and consumption, smoking, and much more generally, how people are reporting the situation has affected their mental health. Next slide, please. And just to bring it down to the Welsh experience, of course, in Wales, we have the Wellbeing of Future Generations Act that was launched in 2015, which places a duty on all public bodies in Wales to work in a particular way to ensure that policies, procedures, services don't discriminate, that they take account of well-being, that well-being is impact assessed, and as a part of that plan, public service boards were created in Wales to carry out those assessments and to monitor the progress of the strategy in Wales. So they're looking particularly at community empowerment and schools approaches across the whole of Wales. Colleagues at the Health and Wellbeing Academy at Swansea are working with every primary school in Wales to develop a programme of mental health literacy. And the intention there is to give children and their teachers a common language of mental health, to reduce stigma and to enable them to actually share their experiences and be able to ask for help and to feel that it's okay not to be okay. The other thing that the Welsh Government is focused on is the impact of adverse events on the life course that occur through childhood and trying to track some of that. And of course, this could be classed as a mass adverse effect because many of these children are really thrust into a new normal of not being in formal schooling. And they're promoting ideas about well-being in work. And again, Health and Wellbeing Academy's work is trying to do that throughout the staff and student community and the stakeholder communities that we serve. Next slide, please. The other thing I just thought I would give a mention to is that we need to think about well-being in a much wider concept, as a much wider concept in terms of the global burden of disease, the fact that anthropogenic climate change does have an effect on well-being of the whole population. And there is a gap between psychological science, population health, and health systems. And it's important that we can create those positive social ties, not just with people, but with the environment. So this is a piece of research that myself and others at the Health and Wellbeing Academy have been developing, and have actually developed a theoretical model of well-being that focuses on the natural environment, meaningful relationships, healthy mind and healthy body, and strategies for positive change. Final slide, I think, please. So that's it from me. Thank you so much for inviting me today. It's been a real privilege. I just wanted to leave you with those images, and these are photographs that were taken at the Health and Wellbeing Academy by a group of health service patients who've had a traumatic brain injury, and they were part of a mindful photography session. So that's just one way in which we can help our well-being. Thank you very much.
Thank you, Julia, for the presentation and for those last few notes on the relation of kind of the individual well-being and societal well-being and the impact that has on the planet, and the trickle-down effect onto people. It's really interesting to consider also, especially as cities are now moving towards rethinking their policies, not just cities, national governments too. So with that in mind, I think we can really start thinking about the next steps for those cities, and hopefully share, like you said, the different strategies for mental health, and hear more about how mental health and well-being can have an impact, not just on the individual, but on the societal level. Maybe a brief question, because again, we always seem to run out of time during these webinars because presentations are always really interesting. So today, one of the key questions and the key aspects that you mentioned is the idea of loneliness. Knowing that organized learning really tends to happen in groups, have you developed clear ways for cities, or for Swansea anyway, to deal with that particular lack of connection, and to continue to motivate students in a time where they're forced to really work from home without necessarily feeling connected at all to anyone or anybody, physically speaking?
We're just at the university level in the process of developing those strategies and structures. We have a system of called Connect that we're using, and that's being developed in collaboration with secondary schools. So that's with students before they come to university, to try and highlight and flag up those pupils in school who may struggle making that transition into university, because they're not natural joiners, they're not the extrovert people who may join a group or a society, whether that be online or in real-time physical space. So we have organized groups of community connectors who can do that on a one-to-one basis, and they'll be introduced to that community connector before they join university. So that's just one small example on a university level. I think, it's work in progress, isn't it, really? Because I think we're all learning what it means to connect in both the virtual and the physical sense.
Thank you for that. Also highlighting the role of community learning as a whole there. It's great. I will be moving on now to our third speaker for today. I'd like to invite Mr. Camillo Yunes from the University of Manizales, the town of Manizales in Colombia. Camillo, I'll be uploading your slides right now, and you can start your presentation. And thank you. You just have to unmute yourself. And let's see if we can hear you. Can you speak now?
Okay. Yes. Can you hear me?
Yes.
Okay. Good morning in Colombia, and good afternoon over there in Europe for everybody. Thank you very much. For me, it's a privilege to be here sharing with you some challenges and initiatives that we've been developing here in Manizales, in Colombia, where we live. Can you go back, please? I would like to say at the first that this, I'm talking on behalf not only of the National University of Colombia, the university who I am working with, and but I'm talking on behalf of the Universitarian System of Manizales, SUMA, and Manizales Plus, that it's additional with Manizales Campus. Three very important initiatives of the city where we are working with the governance and some private companies, also with the universities, public and private ones here since 10 years ago. Next, please. I always try to present where we are located because nobody knows where Manizales is actually. We are in the middle of the tropic in Colombia. We're just in the middle of the mountains at 2,000 meters above sea level, where the Colombian coffee is produced. This is important just to know who the challenges we are facing are related with the place where we are living also. Next, please. Manizales as a city has been developing several steps on their strategy that have been developed trying to attend this pandemic as everybody in the world has trying to face. But I would like to, we start facing that a little bit after everybody in the world. I mean, you know, it started on China, then Europe, and it arrived here a little bit late on March 14. We start doing that, and we have. I want to remark to a couple of activities, and it's maybe the main focus of my presentation that is in relation with solidarity. How to attend low-income families and the problems in relation with their not formal labor activities and the economy of the city. I think that it's maybe the most important challenge we have facing here in Manizales. Next, please. Can you, okay. Manizales, can you go back, please? Manizales is a very interesting city and it's not so common in Colombia. We have a lot of students here in Manizales. 1 of every 10 person who lives here are enrolled in higher education system. And they come from a lot of places in the country, basically from most of the regions of the country. They used to come here to Manizales to study. Half of our students in the city are not from Manizales, not even from the region near Manizales. And they used to come here because we have a very structured system, universitarian system. But what we have been facing here is that the strategies defined by the government have been so useful facing the pandemic, but especially because this strategy was based on the isolation and closing the city, so nobody could leave the city from one day to other. It was on Sunday, 14th of March, and then on Monday, 15, nobody could leave the city. So all these people who live here, and most of them who live alone, must face the isolation by themselves. Additionally, we don't have enough resources, especially IT resources, technological resources to face the academic issues. So internet access, for instance, is not the best for the students. So they're alone in their homes or with a very few people with them and not at all internet access. Additionally, the economic issue, not only because of the economic activities of the city, but because of the economic activities of their families in a country like Colombia, that more or less 60% of the student of our families in Colombia, they have no formal jobs. So they're facing a really hard situation with not economic resources, not internet access, and the isolation. You can see there in that slide how was our life in the upper left corner before pandemic. This is a picture in our university. And how on the right corner, upper right corner, how was maybe one activity in a humanitarian route that we could use with our university buses, trying to move to the closest cities in the region. Our region, the name of our region is Caldas. And in the corner, the lower right corner, even an issue that we've been facing not only in Colombia, that people who is trying to help with the medical issues, the medical personnel have been facing problems with even with their neighbors or with the transportation in the city, because even some people don't want to take them to the hospital, for instance. So we have been using our buses of the university, trying to create health routes in the cities, trying to face the challenges. But I want to tell you a really interesting initiative. Next, please. One of the universities of our universitarian system is Universidad de Caldas. It's the Caldas University. It takes the name of the region. It's the main public university here. And they have, fortunately for the last 17, 18 years, a really interesting telehealth initiative, also with other university, a private one, Universidad de Manizales, that it's the two university with medicine schools in the city. And it's been possible to face the challenges of the pandemic, especially because of the help of this university initiative, telehealth, with different areas, especially next one, the telepsychological attention, especially to our students, but also to most of the people in the city, in a very close relation with the health authorities of the governance of the region and of the city. The numbers, I have to apologize because a lot of information in this presentation is in Spanish. I didn't have enough time to get information and put it on in English, so please forgive me for that. But you have some numbers on the slide on your right with the teleorientation, online, individually, telemedicine, telepsychology, the virtualization of the courses facing the COVID-19, and different kind of strategy with the third age people, because we have a region also with a lot of people, elder people. So all these initiatives have been making possible to face the pandemic in our region. Next, please. I would like to finish saying that I said at the beginning that the focus is solidarity. We all the time used to say that resilience is the goal, but to be resilient, you need to be solidary. If you don't have solidarity, you cannot be resilient. I would like to share some initiatives, just a very few of a lot of initiatives made by our own students, for instance. On the left, our own students, they've been making some initiatives to get money, to buy some food and take it to isolated colleagues or students that they don't have even to go to the supermarket and get the basic food for their activities. If you don't have food, you cannot study. And maybe getting fit is the basic to be resilient. And if you are not solidary, you cannot be resilient. So I would like to share, and because it's so grateful for us to see how our community have wake up and go out, and all that mental structure based on individualism. Now we are understanding that we need to live in community and to be solidary. Thank you very much. I think with that slide, we finish.
Thank you, Camillo, for that presentation and for an interesting perspective as a university city with the important role of higher education institutions in the time of crisis, but also for linking the aspect of solidarity to resilience. I think this transitions really well into our next presentation and our final presentation before we get to the Q&A session by Ms. Marilyn Turkovic from the Charter of Compassion Network, joining us from the US. I'm not exactly sure where, but Marilyn, the floor is now yours for your presentation, and we'll then be moving on to the Q&A. I invite all the participants for today's webinar to include their questions in the Q&A. I've already seen that there's a few. We'll be taking those and reading them out right at the end.
Thank you. I'm really located on a small island in the Puget Sound area in the northwest part of the United States, very close to Canada, and a ferry ride from Seattle of about 40 minutes. I don't know how many people know the Charter for Compassion, but we've been around for 10 years. Our main thrust is to work with community organizations at the grassroots level in cities around the world. We have about 140 cities with whom we work in 54 countries. And you can imagine that our main way of communicating with one another has been through the internet. And we do an awful lot with Zoom, both from a meeting perspective as well as through sponsoring a charter education institute, where lots of people are used to coming to sessions. And so, as many of you know, for the United States, the Seattle area became the first epicenter for the COVID-19. And we, in February, started to really reassess what we were doing and how we might really draw in our community. We have about 160,000 people who work through various cities and who are members of the Charter for Compassion. So one of the premier courses that we do is something called Compassion Integrity Training. And it's a training that is 10 weeks long, and we do it online. Oftentimes we also do it in person. And the whole idea of it is to learn self-compassion and then compassion for others, and then understanding how compassion might work in the context of relating to, transforming, or sustaining institutions. And so we looked at that course and thought, since so much of the course is about resiliency, that what we would do is really put aside everything that we had planned from March, and I'm not sure for how long. But because we're also a global community, we had to pay attention to the world calendar. So what we set out to do was to try and offer sessions that would be of help to people. And so we started each day at almost this hour of the day with meditation, so that we would reach the Middle East subcontinent and the Pacific area. And then we would then move into another meditation, which would be for mostly North and South America. We had people register for these. They're all free, but we just wanted to keep track of people to see, who was coming to what sessions. We found almost immediately we had small groups of people. And when I say small, we might, our resiliency and practice, which is a core part of the offerings that we've been doing. We started with about 380 people in a session. We are up now to almost 1,000. And so, you can almost feel the momentum of need and angst that people have. So we're trying to do a little bit of everything. We thought when we started that we would do these programs for 7 weeks. We now have extended them for another 7 weeks. They're offered almost every day. And so we have, as I said, the 2 meditation programs, one under the philosophy of Thich Nhat Hanh, and then a second one, which is much more mindfulness. So they're 2 separate ones. Then we have the resiliency and practice. And what we try in that particular class, because it is so big, but Zoom is quite incredible when you do know how to manipulate it. You can break people down into sizable groups so that they can converse with one another. The one thing that we have found is that people not only come to these hour-long sessions, but then they create their own opportunities for talking with one another. And the wonderful thing, at least for the work that we're doing, is that people meet from all over the world, so that they are realizing the fears that they have, the concerns, the loneliness, is something that is shared. So we have people on these calls from Spain and Portugal, Germany, to the continent of Africa, to North and South America, Canada. And then the other thing that we've been doing is working with caregivers and caregivers and their children. So we have 2 sessions a week where parents who might not have ever realized what it was like to be faced with homeschooling and what does that mean to them. Some of them feeling the inability of doing it, some of them feeling quite rattled about doing teaching on their own with their children, because I'm not certain how it has been in other parts of the world, but in especially North America, very few school systems were prepared to be closed down. And so, and they didn't have things in place for distance learning. So the complexity of people's lives increased even more. The other thing that we have, which is really kind of interesting, is we have something called Coffee, Compassion, and Citizen Discourse, where people come together just to talk and to check in with one another. We try very hard to to have a practice that we can share as a skill during those sessions. And those are 90-minute sessions. And they were to end last week, but the group asked if we could continue. So we have, we are continuing those for another 2 months. And then the third area that we've been interested in is to try and get people who have a lot of expertise in a subject. So we've invited one of our Global Compassion Council colleagues, Robert Youngson, who is Hearts and Healthcare in New Zealand, to give a number of sessions on trauma, and so he will be starting that next month. And also next month we have Kristen Neff, who is really very much into self-compassion, and we find that people when they're involved in the kinds of daily life activity that they have been exposed to, that they forget about themselves. And she's a very positive figure for taking care of the moment and helping people refocus where they are and refocus on the good things that are happening. And as I said in the beginning, when we started all of these responses, we found that people were in smaller numbers. I think that they were not necessarily shy about sharing their needs, but they were cautious because they really had those needs centered inside themselves and thought that they were unique in their own suffering. But now, after doing this for 8 weeks, we're finding that numbers are growing, openness is growing, and people are finding that they're really actually relying on each other, which has been really a wonderful kind of phenomena. And we're somewhat anxious to continue with the needs that they have. We're also starting next week, we've been working on it for a while, a program for children. And we've contacted the various artists who are part of the Charter's art section to see if they can put together a daily program for children and their parents. So these are the kinds of ways that we're responding when you don't have, a set city community or even a regional community. And we're finding that our age range is very different. With the chat, the coffee, compassion, and citizen discourse, it's a younger group of people. Obviously, people who are coming in with the caregivers sessions are younger parents with their children. And I would say the median age for the resilience and practice is probably around 45 or so.
Thank you, Mary.
Yes.
Thank you so much. I don't mean to interrupt your presentation. It's fascinating, and we've been receiving quite a few questions. We're just running out of time, and we've just gone over time, but we will be asking questions, and we hope that the audience is able to stay. But thank you for that. It's fascinating to hear the kind of the thematic ways you're approaching the situation and the types of strategies you're developing for homeschooling, which is one of the big topics in mental health well-being. One of the questions having to do with how do you deal with parents that maybe don't have the same level of education as others to not foster the widening of the gap between outcomes for your children? That's one of the questions. And also, how do you avoid overusing digital solutions in the context of the COVID-19 and homeschooling? And in connection to the school closures at the moment, we're finding that a lot of children are being homeschooled, and a lot of the time with large inequalities, either not really doing schooling as much as just watching TV or using digital media in a way that's not really schooling. So I'd like to open the floor to those questions on overuse of technology and strategies for homeschooling, dealing with parents, and another one that is related, but maybe some details around strategies for younger children as well, so early childhood education in the context of the COVID-19 homeschooling, or just at home. Let's start, maybe we'll move things around a little bit. Let's start with Julia with those questions, if that's okay. If possible, a minute, and then we'll move on to the next.
Sorry, were you asking particularly about homeschooling and the challenges?
I've asked a few things. I know I'm just trying to squeeze a whole bunch of questions into one. So if you can address some of the points around homeschooling, overuse of technology, and
Yeah.
digital solutions in education, and to some extent, how do we keep the gap from widening between in terms of inequalities
Well,
for parents with the, yeah.
I think one of the interesting findings from the Understanding Society survey that was undertaken showed that actually the Generation Z and Millennial generation are really finding solace in using digital technology. There's been an increase in things like accessing YouTube, Instagram, TikTok, all of those sorts of things. So I guess it's about recognizing what are the activities that they should be engaging in through those media, and trying to compartmentalize it so that there is a definite tone and means of presenting information that is useful to them, but that is separate from leisure time, and building in strategies that help them compartmentalize their day, so that there is some structure in the day. It's not just you pick it up and you do it anytime, anywhere. So I think, again, I'm talking to a student yesterday. She was struggling with the fact that she is homeschooling, plus she's a student herself, and she's a housewife and a mum, and she's having to combine the whole lot. So, you know, what I was saying there was, you know, you can spend the whole of your day and evening in front of a screen. So it's trying to have a timetable, have a plan, and make sure that you're using those screens for specific purposes, and delivering the information in a way that is easily digestible for the audience, I guess. So it's for young children, lots of interactivity balanced with time away and physical activity, and getting outdoors into the garden, or if you can.
Thank you. Maybe Camillo, if you wish to intervene on this particular topic and those questions.
Yeah, thank you very much, Mary. I think that one very important key to approach to using technologies that we've been facing right now is not only to develop the same activities online, because everybody's trying to do the same as present. If you are facing your students now using technologies like you are using right now. And additionally, you need to understand the reality of your student. Maybe in a typical home here in Manizales, you can have a family with the mom, dad, and a couple of children, but only with one computer. So you need to understand the reality of the families and try to adapt yourself as a teacher, as a professor, to that reality, and not only try to do the same as if everybody were in a room in a classroom. So this is a very big issue. And additionally, try to use different strategies, not only pedagogically, but some strategies using different ways. Let me make an example. If you decide to use just Zoom like we are using right now, people could be aware that they have no time or they don't have the resources to use it. But if you say, okay, students and families, what are your best communication channel? We can divide that on different strategies with different technologies. But of course, this is a lot of work for the teacher, for the professor. So we need to understand that we are facing a worldwide pandemic, a crisis, and we need to understand that the important is to get engaged the student, not only the contents and how to evaluate, because a lot of people are worried about how to do the same like in a classroom, and not trying to be connected with the students and trying to imagine a future with them that it's maybe the most important right now.
Very helpful, Camille, for that. Thank you. Also, just highlighting the role of teachers in this particular scenario where having to adapt and know what to use. This is the topic that's come up before. Also, the overcrowding of the actual tools available for people without really making clear any or particular efforts to making them more relevant or more useful and really sticking to what works for students and teachers. Monica, if you have a few words to share on this, and then we'll move on to Marilyn. And just before I give you the floor, Monica, just give me 1 second to say that there are lots of questions in the Q&A and some questions directed to specific speakers. I'm inviting speakers to also open the Q&A so the panelists have access to the chat and can review the questions, and feel free to type your answers. I see that, Julia, you've already started doing that. Marilyn, a few questions for you around the availability of the sessions you've mentioned, access information to the meditation and the charter. Please feel free to respond directly. But I don't want this to take attention away from this particular conversation, but just be aware that it's there. Monica, please go ahead.
Thank you very much. And just a couple of words, and I want to pick up on something that Camilo has said, because I think this is very important. And when from the public health perspective, so two aspects. One of the risks that we face in seeing this as a new normal. So we have to maintain this in mind, that we are not transitioning out of this scenario in the immediate future. Without a vaccine, without proven therapeutics, we are having to learn how to live with the virus. And this means the digitalization, or what we are innovating and learning with in terms of the tools and the processes. These are going to become our main channels of engagement, our main channels of access. And one of the main issues I think that we face in terms of building resilience and providing that support is, as Camilo mentioned, for leaving people behind. So we know that there are groups that will find this more difficult. We know that there are groups that we do not capture, single parents who are unable to commit to lifelong learning. For example, those who don't have access to the technologies and so on. In transferring our tools into spaces which are already not as inclusive as we might want them to be, we run the risk of entrenching and ingraining inequalities. And I think this, speaking now to the learning community, would be my challenge to you in terms of how to ensure that our practices and our processes remain inclusive and accessible. We're only as resilient as the least resilient of us. This is certain. And when this will end, and when it does end, we cannot afford to have left people behind. We have a duty and a responsibility. And from the public health perspective, we have a long-standing approach, which is basically we need to go and where people live, love, work, and play. So we need to go to where people are to provide them with what they need in order to be able to fulfill our duty and our responsibilities. And so in previous, for example, sessions I've had the privilege to listen to, we had some fantastic examples of libraries transferring their services to home by home. So providing continued access to these resources, even if that is no longer, even if the particular family or the particular community finds that more difficult to access. So perhaps as a plea as we're coming to an end, to keep these issues of inequalities, this issue of distribution of our assets, that we're not concentrating our activities in the hands of those who are already able to access them, but rather are mindful of those that we cannot immediately see or who may not have the possibility to do so. I think this will be critical for us to meet our commitments to recover better.
Thank you, Monica. Thank you so much. I'm going to give the last remarks to Marilyn on these different questions that have come up, and you have just about a minute and a half.
Okay, I'll try and be fast. I think the one thing that we can express to each other is that we're in this together and no one is an expert here. And I know that teachers feel an incredible angst because they're so unsure of the technology. And I find that asking students, how do you think we should learn this, is a great opportunity. And it really provides a lot of variation in a given day. So I would really encourage that we seek that out, because we don't have to be in front of this thing all day long. A teacher can enter into a lesson, say, this is the objective of the lesson. How's the best way that we can really make this work? Let's go away for 45 minutes and come back, or 20 minutes, whatever it might be, and find out, what you wrote, or what it was that you were able to put together. In terms of parents, I think the same thing. People who, as Monica was saying, there's a lot of inequality in, all over the world, where, some families have only one computer, some have none. And what's happening, and if they don't have a computer, it's sad for us to say we're not able to reach them, but we try hard to work with organizations who might have access to giving families computers, and it's a beginning lesson. And so I think there's not one great answer for all of the questions that you did ask, but it's a really wonderful challenge, I think, in front of education. We always knew that, content was now in the hands of the computer, and what was in the hands of the teacher was the good exchange and the processes of helping students learn life skills of compassion and kindness and empathy and all of the other things that are necessary for us to work well in common humanity.
Thank you so much, Marilyn, for that. It's a great way to actually end the session for today. We've received really positive feedback and a lot of questions that we haven't been able to address specifically. That being said, it seems that the next steps for us will be really kind of showcasing practical strategies that based on what you've all mentioned. We've talked a lot about building resilience and linking it with solidarity, developing life skills, such as compassion and empathy, and talking, generally speaking, about closing that gap between the different inequalities that we're very aware of at the moment, even in terms of just digital access to information, digital resources for students, well-being of students, parents, and teachers. So with that, I think we'll really look forward to gathering the different information you've shared with us today and making a clear summary report with linking clear strategies, and hopefully if we can get from you and from people from the audience who could share with us testimonies or examples of strategies that have worked for certain groups now that we've been in the crisis and in the situation for a long time, or starting to become a long time. People have started to develop and use resources and have been able to witness the impact of those that we could then share with the rest of the people listening to us and interested in this network and in the different networks that we've listened to today. So with that, I will pass the floor to Christina for final remarks. And I will just say we're inviting you to join our webinar next week as well on distance education and learning, same time with a different link, and invitations will be sent through our UIL newsletter, for which you're welcome to also check the link to sign up directly in our chat. Thank you very much and see you all next week. Christina, over to you for final remarks.
Thank you, Marie, and thank you all presenters for the excellent contributions and the interesting questions and answers. And I think it was really great to be informed about so many new strategies, practical examples, new resources produced by WHO within the last 24 hours for cities and well-being, health and well-being in cities. Really very interesting to see that there are initiatives coming from students, initiatives for students, and that everybody here around the table had vulnerable groups in mind and was also mentioning them. I think one thing becomes clear as well, that lessons must be learned from this outbreak for future situations, for future emergency situations. This pandemic might not be the last one. Countries and cities will have to learn that mental health interventions should be integrated into public health preparedness and to emergency responses. We could see that cities are providing direct support at grassroots level in order to reach out to the most marginalized communities. This is their strength, but also their challenge, of course. While this is a crisis situation, it can also be seen as a window for providing critical health education and promoting this topic of health and well-being of families and learners now and in the future. It is a window for partnership and cooperation between different sectors. Our guest, Monica from WHO, stated that there will be a new normal and there is no easy exit strategy right now. We are in a transition period. And I think once again, this shows the importance of networks. It's only through networks such as GNLC, the Charter of Compassion, or Healthy Cities Network that we can stand together being distant. And so connectivity and solidarity are really key for this transition period. Let me finally point out to the production of some UNESCO education issue notes. They were prepared collectively by UNESCO education colleagues across the world, and they actually pick up these different very important themes such as health and well-being. They can all be found on the UNESCO website. And just to mention a few, there is one on health and nutrition during home learning, and another one on nurturing the social and emotional well-being of children and young people during crisis. Once again, thank you so much. We will continue the series next week, and I hope you enjoyed today's webinar. And stay tuned and stay healthy. Goodbye.
Thank you.
Thank you.